So the question is, what is better, generic or name brand finasteride, which is Propecia? Finasteride was approved as Propecia to treat hair loss by the FDA in, I think, 1997. It remained on the market in that form until it went, they lost their patent. And that's when the generic finasteride came out. Now, the initial supplier for the generic finasteride was a company called Dr. Reddy. And as I understood it, this was the only supplier available for generic finasteride. Now, what are the requirements of a pharmaceutical company to make a generic drug? The pharmaceutical company must have 70% equivalency to the brand name drug. In other words, if you have 1 milligram of finasteride, which is the therapeutic dose for finasteride, that is Propecia. And Propecia, made by Merck, was a 1 milligram pill. The generic only had to be 0.7 milligrams. So what we began to see early in those individuals who moved to the generic product, and they moved to the generic product because it was significantly less expensive. We're talking about maybe $15 a month versus, $70 a month. And so it was a much lower cost product, but we started to see failures. And the reason was because, Dr. Reddy was not making a product that was 100% equivalency. And the therapeutic dose needs to be 1 milligram. It's not that you respond better from, anything above 1 milligram, but you need to be at the 1 milligram to get the response. So people who were maintaining hair or had seen an increase in hair or seen less shedding of their hair suddenly began to experience more hair loss on the generic product. And so for this reason, we would encourage people to stay on the finasteride made by Merck, which is Propecia, or to go to a 5 milligram pill and break it into 4. And the 5 milligram pill is Proscar. So if you break Proscar into 4 pieces, and you're, some days you're getting 1.25 milligrams, some days you're getting 1 milligram, some days you're getting 1.5 milligrams. But if you go to the generic, and a 70% equivalency of that is now 3.5 milligrams. And if you break that into 4, again, you're subtherapeutic. So you might take half a pill, a day, which is more than you need, but it's at least in the therapeutic range. Now, since then, there have been other generic providers that have come out that produce better quality generics, and that means they're closer to the 1 milligram, if not at the 1 milligram equivalency that we got with Propecia. And one of those providers was Teva, T-E-V-A, which is an Israeli pharmaceutical company. And they make very nice generics. Now, whether or not they'll continue to do it is up to them. Remember, these are all businessmen, and Big Pharma, their primary focus is their pocketbook, and their secondary focus is their products. Okay, so then there's a question about keeps and Hims and why the pills seem to look different from one supply to another. And I think the first thing you have to remember is that these companies, they don't know anything about treating hair loss or ED. These are businessmen, and businessmen are always looking at the bottom line. So when you look at net profit, it's going to be your income minus your cost of goods sold. And your cost of goods sold can change based on who you buy your generic finasteride from. Now, in terms of the topicals, these guys have absolutely no idea what they're doing, and they haven't hit a therapeutic concentration of finasteride yet. And I would not encourage you to use any of their topicals. But in terms of their orals, they're going to buy generic products, and more than likely, they're not concerned about the pharmaceutical grade of the products that they're delivering. So, I can recognize that the cost of trying to do business with, let's say, Keeps or Hims cuts out potentially a more costly physician visit. But if you save money and you don't get any response, then what have you accomplished? You're out money and you got nothing. So, you need to be, if you're going to go the oral route, you need to be on a good generic equivalency. And generics, again, they only have to be 70% equivalent, meaning they don't have to be 1 milligram finasteride. They can be 0.7 milligrams finasteride. And that 0.7 milligrams finasteride is subtherapeutic. Okay. Now, if you change generic providers, let's say 1 month you go to Teva, which produces good quality generics, you may get 1 milligram. But, 2 months later, they may send you a pill that looks completely different. Well, it's made by a different generic provider. And, what's in it? Well, I can bet you that Hims and Keeps are not doing screenings on their medications that they're shipping out to their patients to determine the concentration of finasteride that's in their products. I think that explains why the pills oftentimes tend to change in shape and color. So I hope this information you find helpful. And if you have any more questions, please hit us up on the channel.
ForHair is run by Dr. Cole with 30 years of hair restoration experience, and we offer the most cutting-edge technology available. In fact, the ForHair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose ForHair.
We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of ForHair's video uploads. For online consultation, click on the link on the screen or in the video description.